Hello, this is Dr. Scott Mosser of the Gender Confirmation Center in San Francisco. Today I'm going to answer the question, and this comes up a lot, question about drains and whether or not I use them and whether or not patients should use them. So, big picture, drains are used because when we create a space beneath the skin through surgery, and that's something that we do in top surgery, that eventually heals closed, but at first it's open. That open space can fill with fluid. What is that fluid, people ask? So that fluid is basically the same stuff if you were to skin your knee really deeply, that yellow stuff that kind of runs off the skin, that's the fluid that we're talking about. So I do think that overall it's more reliable of a recovery, of a swelling portion of the recovery, for drains to be used, because if that fluid were to start to accumulate, the drain would remove it in the first part of healing after surgery. Having said that, for some procedure types, and it's really mainly the double incision, I let patients make the decision for themselves with regard to whether or not they want the drains. So some patients are really kind of weirded out by drains and they really don't want them, and those patients we simply don't use them. And then they will be in a category of higher risk for more swelling after surgery. There's other procedure types, though, in which we don't let people have a choice because the risk of a fluid collection is just too high. So that would be keyhole, periareolar, and in some cases, buttonhole type top surgery. So that's the long and the short of it. There's a lot more information on my website, genderconfirmation.com/drains, including a video of how to manage drains. And ultimately, this is partly a patient decision and really partly a process of education about reliable recovery and how important that is to patients compared to having or not having drains. Hope that helped.